The FDA has approved the Johnson & Johnson vaccine, and Colorado is relying on it to increase the number of people vaccinated in our state. So Dr. Dave Hnida is here to talk a little bit more about that vaccine, and you've called it a game changer in the past. So what do we need to know about the Johnson & Johnson shot?
I think right now, most public health experts are calling this one a game changer. This is a really good vaccine. It is a one vaccine regimen, meaning you get one shot and within about 3 to 4 weeks, you have a full immune response. It is a vaccine that's very easy to manufacture. It's very easy to ship. It is very easy to store. For example, it does not need to be frozen like the other vaccines. It can be kept in a refrigerator for up to 3 months. And what that means is that there are really little chance for wasted doses here, which is really, really important. And then when you take a look at the safety, the trial showed very safe, plus very effective. Now, I know a lot of people are looking at numbers and saying, well, maybe the Johnson & Johnson vaccine doesn't meet the standards of the other vaccines. It actually does. It was, first off, used in a different population of people during the trials. And we think that many of the people who received this vaccine may, in fact, have been dealing within a mutated strain possibility when they were vaccinated. And so in terms of effectiveness, we look at the one number that is the most important, and that is this. When you look at Moderna, when you look at Pfizer, when you look at Johnson & Johnson, all three are 100% effective at preventing hospitalization and death. And I think when you look at that in and of itself, I think that tells you that you have a very good vaccine. It is really a game changer. I think really going to get us onto a really increasingly better trajectory.
Which is, of course, great news for everyone to hear. So there's now 3 options to choose from for vaccines. So a lot of people have been asking if they'll be able to choose or decide which vaccine they get.
Well, I'll tell you what, the best vaccine is for anybody. It is the vaccine that is available for you right now. I mean, even though we talk about increasing production and increasing vaccination, right now, we still are not able to vaccinate all of the people that really want to be vaccinated and all the people we would like to vaccinate. And I think when you kind of take a look at how we viewed the pandemic in general, we've been talking so long about we have been in this long marathon and we need to be patient. We need to hold on. Well, my feeling right now with these vaccines coming out is that we now are entering a new phase. We are now in a down stretch. We are really a home stretch type of situation, a marathon that is now really a sprint. We are sprinting to get people vaccinated before we have to worry about mutated strains. If someone came to me and said you could have the Johnson & Johnson vaccine today, or you could wait 3-4 weeks before you have Pfizer or Moderna, I would take the Johnson & Johnson today without question.
Great. And I know we know more schools have announced plans to return to in-person learning this month. So really, what should parents be thinking about, or what should they know before deciding whether to have their kids return to the classroom?
This is a really tough one because obviously there really is not one perfect plan. I know the districts are really working hard to go with the best science that is available. And right now, the science is really saying that the schools themselves have not really been shown to be vectors or centers of community spread. So that's very reassuring. We're seeing increased vaccination of teachers and staff. And we're also seeing rates of the disease in the community dropping to a good level. So that's very reassuring. On the other hand, you have to take a look at the fact that more kids going back to school means more interaction, less spacing and distancing, so on and so forth. So yeah, there is a risk involved. But right now at this point in time, I think the message to parents is really this. Take a look at what your district is offering and make sure you are comfortable with it, particularly the school that your child is attending. Number 2, look at the options that are available to you within your district. And number 3, and this is really an important one, You do not send your child to school if your child is sick in any way, shape, or form. I think that a lot of folks are just so used to being, well, my kid can go in even if they're not feeling 100% tip top. That really is what we need to do. Fever in and of itself, for example, is not the symptom you're looking for. Any illness in general is a reason to keep your child out of school and therefore make the return to school much safer for everyone.
Great advice. I know a lot of parents are wondering what they should be thinking about. So thank you again so much for joining us and for all this important insight, Dr. Dave. We'll talk to you again next Monday at 11 a.m. to get more coronavirus and vaccine questions answered. We'll be right back.